Alright guys, we're going to go through the steps for rubric 1 of pulling up a saline for our injections. You want to either wash your hands or use hand sanitizer before putting on your gloves. If you will make sure that it is dry completely, it's a lot easier to get your gloves on. Make sure your gloves are the correct size. Too tight and difficult to use. And if they're too loose, you're more likely to poke yourself with a needle. Okay, so once your gloves are on, we're going to pop off the top of our vial. This is called a dust cover. It doesn't go back on the vial, so once you pop this off, you can start you a little trash pile over to the side. Some vaccinations need to have a little bit of mixing done, so we're going to gently roll the vial between our hands. Once we feel like it's in solution, we're going to open up our alcohol swab, and we're going to swab the vial 3 times in the same direction. So you can see it's still glistening where it's wet. You don't want to stick a needle into the wet top. So you want to make sure this dries fully before sticking a needle into it. So now you're going to open up your syringe and the correct needle for the immunization you are giving. I'm going to set this to the side so I don't accidentally touch it or contaminate it while I'm opening up my other products. So on the back end of the syringe, you can see there's the tip and the plunger. We're going to kind of flag those apart and they'll open up. I'm going to put my trash in my trash pile. It looks a lot better to patients if all of your trash is in one place instead of scattered on your work area. So parts of the plunger, you don't want to touch this tip and you don't want to touch the plunger from here to here. This goes up inside the syringe and it will come in contact with the fluid that's going into your patient. So if you touch here and you accidentally contaminate, you could possibly put something into your patient that doesn't need to be there. So you can see you can touch this tip of it because it doesn't go in. So now, without contaminating this, put my plunger all the way in. I've got this to where it's not touching me. I'm going to open up my needle the same way. So there's the tip, the back where the hub is. So you're going to see that this part right here, it's kind of orange. This is called a lure lock. So you're going to insert it in and then turn until you hear it creak. And that means it's nice and tight so the fluid won't leak out around this syringe. So I'm going to put this into my trash pile. So while I've been talking, this has had plenty of time to dry. Put it into my work area. And I'm going to pull out to loosen my cap. Before a needle goes into a patient's arm, you can actually recap it. So I don't want to throw this in my trash pile just in case I need to use it again. So we're going to pull up 0.5 mils today, so I'm going to put just a little bit less air into my syringe. So I pull back my air in my syringe. I'm going to turn my needle over. We go into a vial with what's called bevel up. So if you'll notice, the tip, the long part, the pointiest part is at the bottom and the hole is at the top. That is what it means by bevel up. So you're going to aim for, you can see it's kind of like a bullseye, this inner circle on your saline vial. You're going to go in, you start out at a 45 and then you go straight up and down and in. The reasoning for doing that is to prevent coring in your needle. So if I were to go straight down in there, that little hole is sharp all the way around and it could put a chunk of the rubber into my solution and possibly into a patient, and that's not something we want to do. So 45 to 90. So once I get that in, so remember we don't want to touch any of this, the top of the vial, and we don't want to touch our plunger. We're going to flip it upside down. There is more than one way to pull up saline, so I usually pull back a little bit first and pull some of the saline into the syringe and then put some of the air back. I go back and forth until I have just a little bit more than what my dose is going to be. My dose is 0.5. I've probably got about 0.8. So then what I'm going to do is firmly wrap or tap on the side of the syringe and get all the big bubbles to the top. So once I do that, I'm going to slowly push all the air out of the syringe and push the fluid up to my dose. Once you get to your dose, you're going to remove your fluid, set it over to the side. Here at Texas Tech, we teach the scoop method. So what you're going to do is you're going to make sure this lines up, so the flat part, set it down on your table, and then you're going to scoop this cap onto your needle. What you want to do is not touch this piece until the needle's all the way in, and then you're going to snap it all the way. So we don't want to hold on to this because we could accidentally poke our hand while we're trying to recap it. We don't want to just kind of set it in there. If someone were to come along and knock the table or something, you could accidentally expose the needle and poke somebody. So that's how we do with what we call the scoop method of putting the needles on. So once you've given the shot to the patient, you're going to activate the safety device. Different setups have different kind of devices. This one, you're going to stick your thumb under this little plastic piece, and then you're going to push up. And what that does is it releases the plastic to cover the tip of the needle. Not 100% foolproof. You still want to go straight into a sharps container, but it does cover that needle from the time you inject the patient to the time you make it to the sharps. So that's what we're going to be doing this week in lab.